Are you a healthcare professional who is looking to get hired this year? You've actually been applying to a few different job opportunities, but you haven't really been successful in getting any feedback or even a call back to advance to the second stage of the process, which is securing a job interview. Now you're a little bit frustrated and you're even wondering whether your resume is sufficient enough to grasp the attention of hiring managers. If you just said, yes, that is me, that's my situation, you are talking to me, have no fears. In today's video, I'm taking you behind the scenes and I'm going to show you my detailed resume review and writing process. This is a process that I've been using that has helped me help my mentees and other job candidates that I've worked with be able to secure a healthcare job opportunity, aka get hired. So make sure you stay tuned because this video is for you. Okay, so first things first, why are resumes so important? Let's talk about what I know. Well, a well-written resume have the power to open healthcare employment opportunities. However, after talking to several candidates who have all of the qualities, all of the skill sets, they said, I think my resume is pretty decent, but I'm still not sure why I'm not getting a call back. And if this is your situation, guess what? You are not alone. According to Psychology Today, they said that roughly about 76% of job seekers who said after submitting their resume and not hearing back from the employer, they have said the frustration is more than being ghosted after a first date. And so as you can imagine, that could be really, really frustrating. And when I see such a statistic, the first question that comes to my mind is why? And the second question that comes to my mind is what can possibly be the reason for the disconnect between job seekers and hiring managers? And from my research, according to several recruiters, first thing first, they said that many job candidates, their resumes are not really written in a way that captures their attention. On average, it takes recruiters about 6 to 8 seconds to review your resume before they determine whether they're going to call you in for an interview or not. Other recruiters have said that some of the biggest mistakes that a job seeker make on their resume is not tailoring the resume to the job opportunity that they're applying to. And they also said that another biggest mistake that job seekers make is really having so many grammatical errors or jargon being used on their resume. And so if this has been an issue of yours, have no fear. Like I said, in today's video, I'm going to take you behind the scenes. Okay, we're going to actually do some practical applications. So it's going to feel like a one-on-one session today that really shows you my process that has allowed me to help many healthcare candidates get a job. And in my process, we review content evaluation, formatting, language, grammar, tailoring your job specifically for the job position, because that is important, how to navigate the ATS, and so much more. And here are the tools that I use. And so the first tool that I use is the resume review checklist that I have created. The second one is looking at a few job descriptions that ideally the candidate wants to apply to. I also use a free applicant tracking system. And then this is my newest tool, which is called the Vibe Board. Now, I really didn't like to do resume reviews because it can be really, really daunting. And before I had the Vibe Board, I usually would use like 2 computers and a phone to make sure that I'm able to look at everything that I need in order to make sure that I'm editing or writing a resume efficiently. So I will use my desktop computer with my laptop computer and my phone. And as you can imagine, that process has been extremely daunting. And so much so, it made me stop reviewing resumes for a bit. But now after receiving my latest tool, which is the Vibe Board, and I'm going to show you how I use this board today, it has made my resume review process so much more efficient and easier and quicker to get feedback to the candidates. So without further ado, let's go ahead and get you prepared so that you can get hired. So the first tool that I use is my candidate resume checklist. I customize these checklists according to the position in which the candidate is looking to apply to. So in this case, the candidate wants to apply to a public health advisor role. So I created a checklist that meets those needs. And now I'm going to pull up the candidate's resume as well. Okay, so now that I have both of the documents up, I quickly review the candidate's resume based on my knowledge first and everything that I think can be improved. So the first thing, you want to make sure that everything is aligned correctly on your resume. This makes it so much easier for recruiters and hiring managers to skim through your resume. As I stated, it takes hiring managers or recruiters about 6 to 8 seconds to skim the resume and determine whether they're going to use it moving forward. And so in this case here, you see the indentation is off. I would just tell her to move it close to the left margin. I'm going to quickly read the summary section. You always want the summary section to include keywords that is in the job description. And so in this case, she is looking to apply for a public health advisor role with the CDC. And from just briefly looking at the job description, key terms like leadership, and I'm going to change the color of my pen, and I'm going to highlight some keywords that are instrumental and that are good to include in her objective statement. Then moving down, I'm in the education section. I would tell her to move this to the bottom of her resume, okay, because you really, after the summary section, want to put your professional experience next. But since the education section is here, she has quite a few degrees, but you only want to include relevant information. So high school diploma, you can take that off. The certificate of dental assistant, you can take that off since you have a bachelor's in dental hygiene. Also the associate, you can take that off. Your BS degree, which I'm going to change the color of my pen, and let her know that the BS degree covers all of this. So you can remove. All right. And so I'm just quickly skimming through the resume, and like the skills section, I would also tell her to shift this down to the bottom of the page, because you really want to put your professional experience section right under your summary section. So let's jump down to the professional summary section. So one of the biggest things that I see that an issue is here is that she has paragraphs. And first, a recruiter is not taking the time to read all of this, nor is this ATS, so applicant tracking system friendly. And so I would recommend that she turn all of this into 3 to 4 bullet points that highlights her accomplishments. And so I'm skimming through everything, same thing. This is too much. Nobody's going to read through all of this. And I'm also looking at my checklist as well to make sure that I'm not forgetting anything. And so now she has a lot of information, and this is why it's making the resume so long. And so I ideally would tell you to make your resume about 1 to 2 pages at max. Okay. Now, some things that she does really well on this resume is that she has included certifications. So on my checklist for this type of role, certifications are instrumental. And so she do have a few certs, but you only want to give them what is necessary. Okay, so now that I've quickly skimmed through her resume and I'm just checking my checklist to know exactly what I'm checking her resume for, the next step is I run the resume through a free applicant tracking system. So I've ran her resume through the ATS free scanner, and it just shows her score. So out of 100 points, as the resume is written, the way they submitted it, it's only going to get a score of 12, which is really on the lower tier. You really want your resume to be in the top 90% to 100% percentile in order for your resume to easily pass through the different softwares that hiring managers use and organizations use to source candidates. And so what I love about this particular software, it tells me the areas in which she needs to improve. And this just reassures what I know to make sure that I'm giving her a comprehensive overview of the areas that needs to be improved on her resume. So things like fix the quantifying impact, and it gives you just how to improve. It gives you some examples, which I love. It also talks about the different words. And so as you can see, she's used a lot of the words so many times, so repetition is found. And so this is the tool that I use. So after I've run her resume through the ATS system, I now go and look at the actual job description to see how we can improve the resume through my suggestions using the verbiage that's listed on the job description. Okay, so now that I'm in the job description where the candidate wants to apply to this specific job, I just go look at the duties, and then I will make some notes just telling the candidate to make sure that their resume mirror the duties that are listed here. And so I just take some notes from myself, and I just kind of put check marks to say include this in her resume, right? And then we just look at the requirements to make sure that the resume aligns with what they're asking for. Now, after I've gone through the job description, I go back to the candidate's resume and I pull it up side by side once again. So when I annotate here, I just tell her to rewrite this in her resume. And then I would tell her to just mirror the formatting used on job description. So after I've done all of this, I have my review, everything that I need to just tell the candidate. I love this last part, which is to now provide feedback to the candidate. So the last part of my review is that I go and I do a screen recording using the Loom app, and I just share my whole entire screen with the candidate. And then I start to go over my remarks. So I'll pull back up her resume, which I annotated here, and I just will walk her through the feedback section, and I send it off to the candidates. All right, so that is a wrap for today's video. I hope that you truly enjoyed coming behind the scenes with me and just looking at my resume review process and how I provide feedback to mentees and clients who send me their resumes to review. I'm not accepting any more resumes right now because I do have a few more to go through. However, if you want me to do more videos like this, you can just let me know in the comment section. Also, if you would like to learn more about the vibe board, you can check out the link in the description box. It is truly an amazing tool. It has revamped my whole career development, academic mentorship, and even grading work. And so I'll be doing some more videos about that in the upcoming future. But until the next video, have an amazing rest of your day, and bye for now.